Hello, everyone, and welcome to Neurocracy. Today, we're joined by Dr. Raman Malhotra, Professor of Neurology and Interim Chief of the Section of Sleep Medicine at Washington University School of Medicine here in St. Louis. He's also past president of the American Academy of Sleep Medicine, and his work explores how sleep affects recovery from mild traumatic brain injury, how athletes can improve their performance through better sleep, and how treating sleep disorders can improve overall health. Dr. Malhotra, thank you so much for joining me today.
My pleasure.
So my first question for you is what actually first drew you to study sleep and its impact on the brain?
Yeah, I didn't receive much education about sleep medicine through my medical school. And when I was in neurology residency at University of Michigan, one of our rotations was to rotate through the sleep disorders clinic. And so I was able to get kind of my first exposure. And what really stood out to me was how a lot of the patients with neurological disorders like headaches or Parkinson's disease or dementia would have a lot of sleep problems. And
Yeah.
when they would come to our sleep clinic and we would treat their sleep apnea or their insomnia or their restless leg syndrome, their underlying neurological problem would get so much better. So, their headaches would get better or their thinking would get better or their tremor would get better. And I was like, wow, that's so cool that there's like another way to get someone better just looking at their sleep. And then I did an elective rotation where I was able to look at things like sleep studies or
Yeah.
polysomnograms at any time. And that really got me excited because it's such a cool, exquisite study of sleep. And I had always thought of sleep as kind of a passive state. And when
Yeah.
you measure what's going on in the brain and in the heart and with movements, it was just so fascinating to see the different patterns that you could see at nighttime. And it was kind of a mystery because most people don't know what's going on during sleep. And the sleep study kind of opened up a whole another world of things to treat to get patients better. So that's kind of got what got me started.
Yeah. So I was looking at some of your work and I've noticed very interestingly that you've done a lot of work with athletes and brain injury. Could you elaborate a little bit on that?
Yeah, I'm a huge sports fan, so that was just a
Okay.
natural thing to look at athletes. And as a neurologist, I initially started seeing patients for sports-related concussion, football players, basketball players, so forth, that would get a concussion, and then what is very challenging about concussion patients, and still remains the case, is that there's just so much unknown about how long am I going to be out, and what does this mean long term, and most of the athletes are the main thing they were worried about is how do I get back into the games as soon as
Yeah.
possible,
Well,
safely. And there's no medicine to kind of speed up the process. It could take one kid, 5 days. It could take another kid 5 weeks. Another person, may take a year or longer. And so, what I started to notice is that sleep. Almost all the patients would have problems with their sleep at night. They would either have insomnia after their concussion, or maybe they would
okay.
sleep all day. And so I started to look into, well, is maybe a sleep a good natural way? Because no one really wants to use a medication, and a high school football player or a
Right.
college player. These are otherwise young people on no medications, and so is there a way to kind of naturally get them to get better by kind of monitoring their sleep and getting them to get more sleep after the concussion to maybe hopefully get them back into school and play quicker?
Interesting.
Yeah, and so it's still kind of a big question mark, although again, to me, it seems pretty clear that it seems like a reasonable thing to approach someone who has a concussion. Back when I was starting, which was kind of the early 2000s, one of the recommendations, if let's say if you were playing a high school football game and you got a concussion, you'd maybe go to the emergency department. Obviously everyone's worried. And the instructions when you would leave the ER would be, well, make sure you wake up the patient every hour or two to make sure that they're, still okay and that their brain's not bleeding, and which is a pretty low risk. But what that did is it just disrupted everyone's
Right.
sleep.
Yeah.
And so we've kind of over the last 15, 20 years realized, okay, that was horrible instructions, and instead we should try to get as much sleep as they can
Yeah.
uninterrupted. Don't bother your kid. Let them sleep in to kind of let the brain heal. And I think one thing that we've kind of realized over the last decade or so is how sleep is a healing process,
Yeah.
and that's the same thing in concussion. And so that's kind of a change in culture because that wasn't always the case before, where we would let people, for example, if they did get admitted to a hospital, unfortunately they get very poor sleep, right? So
Right.
even hospitals now are kind of looking at making sure people get sleep, and so concussion is just one disease state where I think it's important to make sure the patient gets enough sleep so they can heal from the concussion fastest.
Okay. So here's what's funny. After we scheduled this interview on November 1st, I actually was playing basketball and I unfortunately sprained my ankle. And afterwards, I'm not sure if this is like causative or this is just something I'm creating my own correlation with. So maybe like you can help me out here. So I noticed that I've been sleeping like a lot more. And I think this was highest when I first injured it, and there was a lot of swelling, and it's significantly reduced now. But I've noticed that I actually had my first nightmare that I've ever had in probably in a couple months. And it was during like a midday nap, which I also rarely take. But in the past week or so, I've taken multiple midday naps that have each lasted like 1 to 2 hours maybe. And it's just my sleep schedule has become very irregular after this ankle sprain. And this isn't supposed to be like some sort of diagnosis. I'm just curious, like how sleep could maybe like be related to this injury that's not necessarily a brain injury, but somewhere else in the body.
Yeah, the our bodies definitely react to, in your case, a ankle sprain or
Yeah.
let's say I had a cold a couple weeks ago, right?
Okay.
When you're sick with something, you tend to sleep more, and it's kind of your body's way to tell your self to get more sleep so you can
Yeah.
recover. So there's a nice even tagline that the American Academy of Sleep Medicine has, which is "Sleep is good medicine," meaning that
Mm.
sleep
Yeah.
just not only helps concussion, but it helps out your ankle sprain, it helps
Right.
out my
Yeah.
cold, helps out
Yeah.
mood, it helps out pretty fight off infections. So I think it is true that your body will naturally make you sleepy to kind of force you to go to sleep and get more sleep. Although some people fight it off. And I think most of us think of, well, I'm not feeling good. I should probably get more rest. But I think if we're a little bit more intentional about it, it's going to end up probably letting you recover better. Although, again, like I said, some of this isn't proven yet. There are specific disorders like concussion where they've looked at it, but
Yeah.
something like you said, like your ankle sprain, no one's
Yeah.
really looked.
Yeah.
Yeah,
Yeah.
I've always wondered even about looking at athletes again. What about the player who has a ACL repair in his knee or some other
Yeah.
bodily injury? No one's really looking at that person's sleep afterwards, and obviously they want to recover, and have the best outcome. I always wondered if monitoring their sleep would be a way to kind of improve those outcomes.
Yeah. Yeah, and I just brought that up because a lot of the time on this podcast, I like to bring up my own personal like insights and kind of experiences and relate it to sleep. And speaking of, one of the things that I'm really like trying to push back is high school start times. And I know you've had a lot of experience with advocating for sleep medicine nationally and kind of how that relates to policy. So could you elaborate a little bit on some of your experience in the American Academy for Sleep Medicine and maybe like kind of just give a little bit of a description of like sleep medicine in terms of policy or guidelines.
Yeah, that's a huge public policy issue, and
Yeah.
traditionally the American Academy of Sleep Medicine would kind of stay on kind of medical disorders, things like sleep apnea and restless leg syndrome, and didn't
Yeah.
really venture off into public policy, things
Okay.
like
Okay.
school start times or daylight savings time. But
Right.
over the last 10 or so years, they've really took that on because realizing there's really no other medical organization that should that takes on these type of advocacy. And we are are supposed to be sticking up for sleep, right? So
Yeah. Yeah.
something that they've definitely put a lot of money and time into to try to advocate. Sounds like you are as well. And with the school start times, it's an interesting topic only because uh, I think the data is clear that kids getting more sleep are going to do better in school and be healthier, and obviously the early school start times for that age group is going to be very difficult for them to get enough sleep if their circadian rhythms are off. And I know that, like I said, viewing some of your other um,
Yeah. It's a
uh,
big
videos
topic.
has been
Yeah.
has been yeah discussed.
Yeah.
But what I think is so exciting is that there have been some states that have adopted laws already. Florida, California,
California, definitely. Yeah.
and then there have been school districts specifically, individual ones that have also adopted it,
Yeah.
had great success too. So
Yeah.
most of the challenges I found have been very logistical, like what are we going to do with the buses or the sports or the activities, and
Yeah.
those are all very important because we have to be practical, but. It's so interesting that really the health of the kids should be probably the priority and not, the schedule of the sporting events or the bus schedules. It's just it's amazing to me that I think that link between sleep and health is still just missing in kind of my generation, which is why hopefully your generation that will remember what that early start time did to you and that you can make
Yeah.
a change because I do think we'll be better off as a society with making sure our high school students are not sleep deprived and able to function best.
Yeah. Yeah, and I think part of the reason why like I advocate for it so hard is because I myself go to a high school here in St. Louis that starts at 7:30 a.m. And I know you've had I know you have like kids is um is one of your children in high school or middle school right now, I believe.
High school,
Yeah,
so
yeah. So,
that's right.
right. So I think you'll probably see that too, like from the perspective of parents as well. And I think you and I can both agree that sometimes it's easy to like almost see a child's or like teenager's sleep deprivation as a sign of laziness, um, as opposed to like kind of what we're talking about here, like the internal biology and what's actually happening to
Yeah.
the circadian clock.
Yeah, I kind of equate it to if you made me go to work at a time that was too early for me, like if you
Right.
said
Yeah. Yeah.
work shift starting at 4 a.m.
That's exact time there.
It's not going
Sense.
to be
Yeah.
a very good physician. I'm not going to be a very good
Right.
worker. And regardless of how much I try to go to sleep earlier at night, it's not going to happen. That's kind of what we're doing to our high schoolers. So I agree with you. I think it has a huge effect on some. Obviously some high schoolers do perfectly fine, but a
Yeah.
large portion have a really hard time trying to get to school and start at 7:30.
And I think part of that difference comes down to like chronotypes, right? So do you observe like this kind of like I guess differences due to like people's like just own I guess biology in terms of like recovery from athletic like injuries or how do you see that kind of play out in terms of like recovery times, I guess. So
Yeah, we haven't. I would think, and obviously, I don't see athletes for especially non-neurological injuries. So,
right,
but
okay,
yeah,
yeah,
that chronotype is not really looked at very much. It should be, but meaning it's just not something that doctors look at if you have a knee injury or head
right,
injury.
yeah, yeah,
They kind of just
obviously, yeah,
assume that everyone's on a normal schedule in quotation marks. But I think probably what has been looked at is the risk of injury, though. So, for example, people who are kind of fighting their own internal clocks, maybe being out on the practice field too early in the morning,
mm,
or maybe they're morning larks and it's they're out in a ice skating rink for hockey
yeah,
or something really late at night. When they're tired, not surprisingly, your reflexes are down. You're not able to catch yourself from getting injured, and so you're actually more likely to be injured if you're sleepy or tired, and that has something to
mm.
do with your internal clock. So that is definitely something that has been looked into, but we sort of ignore.
Yeah. So the next question is kind of like on a more futuristic note. So I know there's I was talking with some people about Apple Watches and kind of their technology as well as just wearables in general. It's a topic that I bring up a lot. So I'm curious, how does that kind of how do you see that kind of playing a role in terms of like maybe potentially using that data in the future to improve like studies or maybe even just helping people kind of learn more about their own sleep? Like how effective is it truly?
Yeah, we almost usually when we study patients, we get like one night in the lab, and then
Right.
it's clearly not
Yeah.
going to give us a lot of data about what's going on a night-to-night basis. And so the cool things about Apple Watches and other consumer wearables is that we're able to get data every night. I guess for every night of the year.
Yeah.
And so, although the interesting thing is what it's measuring is different than what we measure in the lab, right?
Yeah.
There's no EEG leads. There's
Yeah.
just different sensors, so it's not wrong or
Right.
correct. They're just different. And so we're still learning what those signals mean and how they correlate with what we're used to seeing in the sleep center. And so I think what that's going to lead to, though, is we're going to be able to see patterns that we don't normally see. If I wanted to, we talked about injuries in sports, for example, and I said, well,
Yeah.
no one's really measured, if someone doesn't sleep well, does that make them recover from, like your ankle injury faster or
Yeah.
slower, depending on how you sleep? Well, that would be a really hard study to do back in the day because I'm not going to put you, with your ankle injury into my sleep lab for a week, right? That
Yeah.
would be pretty expensive and it would also
Yeah.
alter how you'd sleep. And but actually, it's possible that someone who has an ankle injury would be wearing an Apple Watch or a consumer tracker, and so now we could, in theory, I don't know how many ankle sprains there are in the country, but I'm guessing a lot. You could look at thousands
Oh
and
yeah.
thousands
I
of
mean, I
him.
think it's the most common, like
Yeah,
just
yeah.
general like athletic
And so
injury.
you could
Yeah.
look at thousands, if not millions, of people and see, okay, well, this group had really poor sleep, and this made their ankle, symptoms last longer. This group that had better
Yeah.
sleep did
That would
better,
actually
or
be very
yeah.
interesting.
And so I
Yeah.
think we're going to start to see patterns, and then just even more interesting with technology is that we could take those sensors and use like an artificial intelligence tool to help analyze the data very fast. So it may take,
Yeah.
you and I a really long time to figure out this
Right.
pattern, but we
But
pop it
with
into a
yeah.
computer and they're
Right.
going to tell us things that we could never tell before. So I think we're still trying to dip our toe in that type of, massive amount of data. So we haven't perfectly figured out how to use that data yet. But I think as we get more patients to use that and as we get
Yeah.
databases of trackers, we're going to start to see some patterns that I think will be helpful.
Yeah. And I think there's also kind of like a little bit of pushback in terms of the privacy of the data. So I think we'll definitely see some of that kind of play out in the future. But I think it would be like super cool. Like I mean, it's like definitely come up before when I ask about this question. Like the idea like you'd have so much data at your hands of so many people that like there'd be so many things that I think like you said, we wouldn't really it wouldn't have been realistic to like study or analyze maybe like 10, 15 years ago, but like in the future, like I mean, I think there could be some very interesting things that could be found.
Yeah.
So yeah. And so I know we've been talking about athletes a lot. So continuing this discussion of them. So for athletes who especially find themselves like working like a lot, like working out, like working on their sport, what would you say is a practical like measure or kind of like a thing they could do with their sleep to kind of help their athleticism or kind of their performance or maybe even like protect themselves from injury in a way
Sure.
from in like a preventative way almost.
Yeah, the number one thing really will be getting enough sleep. And so,
Okay. Yeah.
not surprisingly, as we talked about school start times and how busy everyone's schedule is as you go through high school or adulthood, that seems to be the biggest issue. And there's really good studies showing that if we call it sleep extension, which is just a fancy way of saying that we're letting people get enough sleep. Over a 1 to 2 week period, you'll see changes in their athletic performance, whether it's, their golf scores or their free throw percentage or their sprint time, tennis serves,
Yeah.
double fault serve
Yeah.
things. They've done a lot of studies like that showing that
Yeah.
literally just giving someone more sleep over a 2 week period will improve those. And you can imagine if you did that for longer, how much better athletes would do. And so I think just getting enough sleep, which is a hard thing to do, mind you,
Right.
but
Easier said than done. Yeah.
but I think a lot of athletes, rightfully so, they're very competitive, they're high achieving. They're probably thinking, well, maybe I need to squeeze in some more practice,
Yeah, yeah. I think yeah.
maybe do some more homework. And so maybe we need to start teaching, well, no, actually, if you go to sleep, you'll actually be better off than even doing that extra practice, which is a hard trade-off or hard thing to think about, right? Because we kind of think the more you practice, the better you're going to do.
Right.
But there is a limit to that, meaning if you're cutting into your sleep time, you're actually overall going to be doing worse than someone who actually goes to sleep and lets your brain kind of process all those things that you learn during the daytime.
Yeah.
Yeah, and a lot of athletes do practice that. I've seen interviews from people like Tom Brady,
Yeah.
Tiger Woods. They would mention that they really protected LeBron James. They protect their sleep, meaning they make sure that although they obviously work very, very hard and practice, a
Yeah,
lot more
of course.
than
Yeah.
most people since they're elite athletes, but they still will protect their sleep time so their body can recover. But more
Yeah.
importantly, it actually lets your brain process what it was learning during the daytime.
Yeah. So this kind of like I kind of had this question pop into my mind. So how do you think like this kind of translates when let's say there's an athlete who travels a lot, and I kind of had this discussion with someone from University of Michigan actually, Dr. Ravi Alada. I'm not sure if you know him,
Yep.
but he was kind of talking about how at one point he was actually like I think talking to someone in the Cubs about like helping them with their like kind of the idea of jet lag and how I think the idea is that if you move you can acclimate to 1 hour change in time zone per day or something along those lines, I think. And I think that's right based on your nodding. But I'm just curious, how does like jet lag kind of play a role in this from your experience? Or
Yeah, it
yeah,
definitely can play a role, especially when we're talking about, elite athletes where, literally a small fraction or margin of
yeah,
improvement could be a difference between,
exactly.
winning the
Yeah, yeah,
championship and not. So whether it's Olympic athletes, and then, you can imagine Olympics are usually international and it could be a huge time zone difference. Many of the athletes do have kind of sleep sports doctors to help time. For example, let's say if you're a runner and they know when the gold medal match is going to be or the race. They'll make sure that they we know when humans are at peak performance, which tends to be several hours before their bedtime. So kind of late evening is kind of when you'll do best. And you'll do worse, of course, if you're supposed to be asleep, so too late at night, or there's an afternoon dip. And so, long
yeah,
story short, there's kind of peaks and valleys of performance that have
yeah,
been proven. And what they'll do is you can time that using light and melatonin to kind of make sure that your race happens at the exact time as your peak. And actually, athletes already do that right now.
Yeah.
And it's pretty sophisticated, and it's a little bit hard to know how much it helps because the part that I think makes it where it's not like, oh, you're for sure going to win just because you
Yeah.
follow your circadian rhythm is there's so many
Yeah.
other factors
Yeah.
like, of course, the skill level of the
Right,
athlete,
right.
and then
That's
even
probably the
just
most important one.
the extra
But
motivation that they get, and
yeah.
those probably override some of the tiredness. But it is an interesting phenomena that I think is helpful. And yeah, a lot of the sports teams when they travel do ask for advice on kind of what to do, when should they arrive, and what should they do when they arrive, and how do they adjust to the new time zone.
Yeah. So, right now I'm kind of doing like a little project on my own with the professor about like I think I mentioned this to you earlier about Rubik's Cube performance and the time of day link. And so one of the things that I've been kind of thinking about a lot, and it's kind of puzzled me a little bit, is this idea of how Rubik's Cube is both cognitive and physical in a way. So I think I was reading the book Why We Sleep by Matthew Walker, Dr. Matthew Walker, and one of the things that he mentioned is how Olympic records tend to be broken around 1 p.m. And so I was wondering if you could like maybe elaborate a little bit on what you were talking about the afternoon dip and the peaks and like maybe for example like core body temperature and how this all like relates to both like or how it like is distinguished in terms of like physical performance and cognitive performance and maybe in some sports that require a mix of both. And I
Yeah.
don't know if that was like a long question, but maybe.
No, that makes sense. And the best way to think of it is there are kind of peaks and valleys that every human has. And they do follow a predictable pattern, meaning
Right.
there's a peak in that like noon, 1 o'clock time, and then you get this kind of drop off, and then you get another peak, and then you go to sleep. And so that is something you can actually time with things like melatonin levels, which you can get from even saliva. So it's not that hard to measure, or like you said, even temperature.
Yeah.
What you would do is you would basically, find out the person's kind of internal clock and map out when would be a peak time for them to perform. And they've done things like, lifting weights or
Right.
so physical activity as well as mental activity. I would agree with you. Most sports obviously need both. And so the
Yeah.
idea is that, especially for something where you're doing it maybe once or twice or three times, like the Olympics, in one, you're training for 4 years for one event, it would make
Yeah.
sense to kind of manipulate your internal clock to make sure that when that match happens will be when you're not in one of your dips at the
Yeah.
very least, or hopefully at one of the peaks.
So is there like a general like time, like roughly, I mean, for like these dips? I know you mentioned kind of afternoon time. So I'm just curious because see, well, one of the things I see in Rubik's cubes is there's sometimes like I'm pretty sure from like what I'm seeing is that the best performance is generally around 9 a.m. when the first round is, and the second round tends to be around 1 to 2 p.m. And I'm noticing like a little bit of a dip in terms of that time. But I also know that there tends to be like maybe a peak around like 4 to 5 p.m. or maybe sometime around then. And I know that's like said a good time to go to the gym. So I'm just like a little confused by this. So I'm curious
Yeah.
if you could maybe like explain this a little bit.
Yeah, well,
Yeah.
the tricky part is it all depends on what type of person they are. Are they, someone who is that early bird or that night owl, because that would change things by a couple hours. So
Right.
um,
Okay.
that's the tricky part. So like finding an exact time for each person is going to be different.
Right.
But in general, maybe to think of it kind of, holistically, if someone's waking up at 7, let's say in the
Yeah.
morning, the idea is, of course, you're not going to be at your optimum right at 7, but it's typically going to be about 3 to 4 hours later. You're going
Okay.
to get that morning peak. But then soon after that, 1 to 2, 3 hours,
Okay.
you're going to start to get that afternoon dip, and then you're going to get a huge surge
Okay. So
again
the
after
surge
that.
kind of comes after this dip.
That's correct. And so the
Okay.
way to
Yeah.
look at it for like a sports thing, and this is something they looked at for like, for example, like Monday Night Football or something like that with NFL players. I don't know if you've seen that study, but they tested this idea that East Coast teams that travel to, like California for Monday Night Football, of course, the time of the game is the same time, but those games, especially back when they used to kick off at 8 p.m. Central, which is like 9 p.m. Eastern, they would end at like 1 a.m. So the idea is that at that time in that fourth quarter, the New York Giants would be at their like, oh my God, I need to go to sleep, and they've missed their peak. And then someone like the San Francisco 49ers would be at their peak. And so they would actually have a much higher chance of winning, which was the case actually. So against the spread, West Coast teams had a much higher record against East Coast teams. So it's more the best way to think of it, because it is confusing. It's very confusing. Is
Right.
that
Yeah. Yeah.
definitely don't want to be in your time where you're supposed to be sleeping, which would be the afternoon, and then of course like after your bedtime.
Yeah.
And if you had a choice, you would want to be kind of several hours, 2 to 3 hours before both of those windows.
Yeah. Yeah, so I was just a little confused by like that timing of the
Yeah.
surge and the afternoon dip. And the dip is something that's always been interesting to me because you'll probably find this interesting. So actually this year as a senior in high school, I have a senior reduced period. So what that means is I can come home on Mondays and Thursdays at let's say maybe like 12:30, 12:45 p.m. And in the beginning of the year, I didn't have any activities at that time. So I just naturally ended up taking a nap for about maybe like 90 minutes. And it just so happened to be when I was kind of like tired around like 1 p.m. like we just said. So does that like kind of align with what we
Mhm.
see like in terms of
Yep.
literature? And
Yep.
does that also align with like the siesta culture that we see like in Spain, for example?
That's
I'm
correct.
curious.
Yep.
So it's always been
Uh,
something that's been fascinating to me.
Yeah, and you could make a very good case that that is definitely more physiologic and normal is to take a brief nap in the
Yeah.
afternoon and that you'll function better. Obviously, it doesn't always fit with, like you said, our culture where,
Yeah, systemically, right?
hard to take
Yeah.
a nap, but it does seem like the body does do better. And getting back to athletes, many athletes will actually take a nap. It's not unusual.
Okay.
They, of
Yeah.
course, if they're a professional athlete, they could make a good case
Yeah,
that
yeah, I think their
if
schedule.
they're, for
Yeah.
example, pitchers many times on their day that they're going to be pitching in Major League Baseball, it's not unusual for them to take that nap in that afternoon so they can be kind of
Yeah.
extra refreshed going into the game that night.
Yeah. So, I mean, I'm pretty sure, like, from an evolutionary perspective, like, do you think humans had one 8 hour bout of sleep, or maybe it was like fragmented a little bit, or this is kind of also something that's been interesting to think about on this podcast. But
Yeah, no, I agree. There's some really
yeah.
interesting kind of historians looking at sleep, how people slept before all of our
Yeah.
technology.
Yeah.
And,
Yeah.
I have a feeling, although I know the answer is not proven yet, so I don't
Right.
think we know
It's
for
difficult
sure.
to prove, I
Um,
think.
yeah, but I think it does seem like back when there wasn't as much technology, it would be very normal to break up sleep, and I think we probably tried to consolidate it into one period because of the efficiency of it, right? Okay, I'm going to bed at night and wake up in the morning, and there's no other sleep the rest of the 24-hour
Yeah.
period.
Right.
That seems too efficient, and it's probably not what we need. And
Yeah.
it's part of the
Yeah.
reasons a lot of our patients have insomnia is actually they're just trying to fit that idea that we've come up with as a society, but it's probably not physiologic. And it's probably more normal to be up a little bit at night and even go back into kind of different periods of sleep during the night and to have that nap during the
Yeah.
daytime.
And kind of adding on to this evolutionary perspective, in back coming back to that book, Why We Sleep, one of the things that's always kind of mentioned there, and whenever we talk about like the evolutionary basis of sleep, is that in general, like if we have evolved something, it's only because it's enhancing our ability to like survive and reproduce, right? So that's one of the things that was in the book, like the idea that if teenagers have like let's say sleep that's delayed by a few hours maybe that allowed them to kind of be awake while adults were sleeping and kind of increase this amount of time where someone was up and aware of like potential danger. So I'm curious if maybe like fragmenting sleep in a way allowed people to like almost not be like inactive for 8 hours, but maybe like a couple hours and then be able to move, like change locations. I don't know. It's just something that I've kind of been thinking about recently. But
Yeah. No,
yeah.
and clearly people are on different internal clocks, and like you said, it always
Right.
seems like there's a reason
Yeah, yeah, I think part
break
of
it
the
that
reason
way.
that there's variation is because evolutionarily, like if we're living in like a group of like let's say 10 to 12 people and everyone has different clocks, then not everyone's going to be inactive at the exact same time and be susceptible to maybe like a predator or something, like an animal, right?
Yep.
So,
Yeah,
yeah.
no, that's true. The other way to look at that same sort of premise is that there are certain people that are light sleepers and there's people that are heavy sleepers.
Hmm,
You could
interesting.
imagine that the light sleeper would be a good person to have in your camp back in the day,
I
years
would love
ago,
to have a
because
light sleeper.
they
Yeah.
could hear what's happening and wake you up and say,
Yeah.
"Hey, there's someone is
Yeah.
over here."
Yeah.
Whereas the heavy sleeper would probably never survive.
Yeah.
Probably have
And
some other skill
it's
that
funny,
they're doing.
I think we can both agree in like movies, it's interesting to see both kinds of characters
Yes.
and how they play their role.
Yeah.
But so I guess for my final question for you, I always like to look ahead to the future. So I just wanted to ask you, what part of sleep medicine are you most excited about in the next couple of years, whether that's research, clinical, or just like public awareness?
Yeah, I think probably almost combining all three of those is that I think there
Okay.
is a huge interest in the importance of sleep by the public and society, along with other scientists and medical providers. And so I think there's a renewed kind of focus on making sure that kind of this portion of the 24-hour day that we tend to ignore is now going to be focused upon as a kind of a pillar of health. And so I think that that opens up a lot of things like more research into it. We have just so many questions about
Yeah.
sleep that we still need to learn,
Yeah.
but also that importance that hopefully as people get more sleep and value their sleep, I think society will become healthier and other medical issues like car accidents and injuries and obesity and cardiac disease and cancer, those rates can come down if people are getting more sleep. So I think that's maybe what's most exciting is that maybe we found another way that's not expensive to make our society healthier.
Yeah. Yeah. And on that note, thank you so much for joining me today, Dr. Malhotra. It was a pleasure talking to you. It was really fun talking about all these evolutionary ideas and sports. I think it's something that isn't I don't talk about a lot here, so it's super fresh to hear from you. And thank you for making the time to speak
My
today.
pleasure. It was great.